Distribution and name, then send it
7197. Your views, our interviews on Spectrum, Radio 1 FM 90.
Hello and welcome. This is Spectrum on Radio 1. My name is...
Good evening. Tonight on Spectrum, the quest for better healthcare service delivery in Uganda. What are the key issues that need to be addressed to make the situation better? The situation in many Ugandan hospitals
remains appalling, leaving many patients in dire need of services. Poor infrastructure, lack of drugs, health workers, and bad equipment or lack of equipment are only some of their troubles. Many of these challenges have been linked to poor funding. Uganda allocated only 9% of its 2011-2012 budget to health, yet the African standard, as per the Abuja Declaration, in line with the Millennium Development Goals, is 15%. Health workers are also demoralized because of poor pay and other aspects of welfare, prompting many to seek greener pastures in other countries. On the side of maternal health, 16 women continue to die each day due to pregnancy-related troubles that could be slashed if the required drugs, midwives, or equipment were in place. On HIV and AIDS, which continues to be a major health care threat, many people cannot access treatment. Moreover, the budget for drugs has been left to donors who may even be getting tired of supporting us. The Social Services Committee of Parliament is unhappy about the low level of health care service delivery and has thus directed government to address this challenge quickly. So tonight we take a look at some of the key proposals being made by Parliament as we aspire to improve the Ugandan healthcare system. Our guests tonight, Dr. Medard Bitekerezo, Mbarara Municipality Mp, member of the Social Services Committee. You're most welcome, Dr. Bitekerezo.
Thank you so much. Good evening, listeners.
We also have Honorable Rosemary Najjemba Muyinda, Chairperson of the HIV and AIDS Committee of Parliament, also member of Parliament for Gomba constituency. You're most welcome, Honorable Najjemba.
Thank you, Edmond. Good evening, ladies and gentlemen.
Honorable Bitekerezo, let's talk about the situation as it is. When you look at health centers in Uganda, what kind of picture do you get? Are we doing well?
Thank you so much, Mr. Edmond. First of all, I want all listeners to get these issues very, 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 very precisely and to see whether where we are is the best place for us to be as far as health service delivery is concerned. I can tell our dear listeners and you, Edmund, that right now as we talk in our country, the issue of health has become a problem, and even when we are looking for votes, every member of parliament who stood, regardless of the party you belong to, faced a problem of health in his constituency or her constituency. Right now as we talk in Uganda, when you consider the women that are dying while giving birth or after giving birth, right now as we talk, the maternal mortality rate of Uganda, I think it could have gone 435 per 100,000 births.
Right.
But in Uganda now, here we know about 16 women are dying every day when they are giving birth. I can tell you, when you become a member of social services, and remember that I'm a medical doctor who has been in clinical practice for the last 12 years. I have just left clinical practice temporarily to do some little bit of politics here. But I have been in the world, so I've watched it happen, and now I am in social services committee. And when you see the way the budget has been done, I think the budgeting has been a bit unfair as far as the sector is concerned. We have there is a slight improvement in drug delivery at health units, but some sundries are missing. We are seeing so many people being referred to regional referral hospitals and even in Mulago just because of lack of mere catechete. Catechete is something we use to repair wounds or cut wounds actually inside in the theaters, but some people have been referred because of mere catechete. And we have seen a problem of health workers working long hours when they are seen on the ground, because staffing in Uganda as far as these workers is a very big problem, because a very big chunk of doctors and nurses have left this country for greener pastures. By the way, they are not even very far from Kampala here. They are just in Kigali. because Kigali is paying better money, and the health workers have opted to go to look for this money because they want it. Not because they hate their country, but I think conditionally. We have had some doctors presenting actually in our social services committee meetings. The guy comes out and he tells you that the salary he's earning cannot sustain him with his family in a house of about one wife plus 2 children or 3. A house in Kampala now, as we talk, if you want to rent a house, Kampala, you go to Naria, a small house is just about 800,000 shillings per month. Meaning that a doctor surviving on salary cannot rent a house in Kampala unless you do private practice or some other mistakes in order to make some money. Look at we have looked at the nurses and the midwives. I can tell you, if every medical superintendent or executive director of a hospital comes to you and he shows you a picture of one of the houses where the nurses are sleeping, and you have not yet, you have got daughters who want to become nurses, you may say, don't become nurses because you don't have where to sleep. Nurses are sleeping in bad places. But these are people who are delivering things. These are midwives who help our women to deliver. And now, if you see some of the health workers in this country working in Karamoja, and you look at Muyinda, which is near here, my friend, and you look at the way the hospital is, you can see that we have no option as social services committee, but at least to advocate for an improvement in funding.
All right.
Funding, and the better funding, which is aiming at recruiting a health worker and maintaining a health worker at the place of work.
All right, Honorable Najjemba, what's your picture? What do you see when you go around places like Uganda and other places?
Thank you very much. Our moderator, Honorable Bitekerezo, has talked about the situation as it is, but I want to start like this, that issues of health are issues that concern all of us and do not have particulars. And when you go to the hospital or to the health center, the doctor or the health worker you find there will not ask you for your party card or your party affiliation, but will just treat you if he's able to treat you. So I really want to take on this discussion as a discussion that concerns all of us, and a discussion that concerns everyone regardless of their political affiliation. Having said that, I'd like to say that Uganda, like many developing countries in the world, have competing challenges. We have very many challenges and they are all competing. When you look at them, you see that they are all necessary. We need the roads, we need to improve agriculture, we need to improve education, we need to improve health. They are all competing priorities. But to me, I think the health sector should be a priority among priorities. Yes. And if, as a country, as Uganda, we can make health a priority among all the priorities we have, we shall have done a great job for this country. But so long as we look at it as any other, because you cannot do all these other things, you cannot produce, you cannot improve productivity, you cannot be good, you cannot develop the education sector unless you have worked on the health of the students, of the children, of the teachers, of the population. And to me, health is very, very important. It should be top on the agenda. So I really think that Uganda, having signed the Abuja Declaration, having ratified the Maputo Protocol, and all the other agreements, national, regional, and global, we should enforce those declarations that we have signed. For instance, the Abuja Declaration, which says that all countries should give 15% of the national budget to the health sector, should allocate 15% of their national budget to the health sector. I think we need to, as a country, move towards that direction. 9.6%, that's where we are standing now. The health sector is allocated about 9% of the entire budget. Is far too low to improve the situation as it is in the country. So for me, I think we need to improve the budget allocation, but also even this little that is given to the Ministry of Health is not doing what it's supposed to do. For example, the Social Services Committee, where my colleague is a member, has just been discussing the policy statement of the Ministry of Health. And to our dismay, the money that we, members of Parliament in the last Parliament, lobbied for, seriously, we almost walked out of Parliament because we told the government we shall not pass any more loan requests unless you bring a loan which is for maternal and child health, reproductive health. So we actually forced government to bring that loan, and they did. We had meetings even with the president and told him why we need to improve maternal health and showed him all the problems, talked to him about all the issues in that line. But to our surprise, when the money was got, 100 million was meant for health systems strengthening project, whatever that one is. I don't know.
Yeah.
But 100. When we were asking for this money, we wanted the money to go into improvement of health centers.
Yes.
The lighting system. Most of our health centers have no solar in areas where we don't have electricity, hydroelectricity. So we thought we would have solar equipment in those health centers, delivery beds, ambulances, basics especially in the area of maternal health. All this was put aside, and from what we are hearing and what we are reading, the money, 100 million, is going into health systems strengthening project, and the 30 million, which we thought, okay, maybe the 30 million will go into improvement of health centers, has
30 million or 30 billion?
$30 million. We are talking about dollars. $30 million. Altogether, it was $130 million, and they said $100 million will go into health system strengthening project. I'm not sure what it is. The $30 million, which was meant to improve our health centers, was channeled into seminars and workshops, and I really ran mad over that one.
Yes.
Because I know I have toured my constituency in all the health centers, and I've seen health centers where the midwives deliver women on a candle,
Yes.
on a tadova, monaku tadova.
Yes.
There are no, because of course in most areas there's no electricity.
Yes.
But a solar system, which is affordable,
Power in the night.
which is affordable,
Yes.
could have improved a great deal. Ambulances, women die on the way as they go to the hospital. The hospitals are many of them are very far away. So for me, channeling this money to seminars and to workshops, which I know will be in big hotels, in air-conditioned places, with big allowances, to me that is very, very, very bad.
Right.
It's unacceptable.
So where would you like the budget?
So,
the budget to be?
Even with the small percentage that the Ministry of Health is getting, the 9.6%,
Right,
as it stands now,
Yes, it's not being used.
it's not being utilized the way it's supposed to be utilized. The priorities are upside down.
Information.
Yes. Do you think there's corruption, or is it just bad management?
I think there must be something.
There must be something.
There must be something. Why do you want to have seminars and workshops
Okay.
and not tangible things, and not improving the health conditions?
Information.
We'll talk
Okay,
about that.
okay.
Dr. Bitekerezo.
Now, I am a person who comes from a place that speaks the truth. And my mother used to tell me that in case I never told the truth, she would beat me up.
Yes.
So I ate so many chibokos because of whenever I would try to tell some lies. Now, let me tell you guys what I've done. Honorable Najjemba, right now, as I found in this studio, I was coming from the Social Services Committee meeting. I am one of those people who threw out the person who was in charge of reproductive health. And I can tell you, the women in Parliament, they sat down and they said, including this Honorable Najjemba, they refused. They said, we want money to cater for a mother giving birth in Kasangati, a mother giving birth far deeper than in Madu.
Yes.
Look at Mbarara. Mbarara, there are some places called Kabuyanda in Isinjiro there, where there is even no, the road is there, but the women are far deep there. Some of them, they are just being delivered by traditional birth tenants. Now, this money, the government of Uganda got a loan. And when we just scrolled the budget, the person had budgeted some wonderful money for hotels and seminars.
Yes.
And when I saw the seminars, you know what I don't like most for me as a person? I don't like the thing of seminars in hotels, because honestly, in Uganda now,
seminars be held?
we want the seminars can be held in Parliament. We have got free building of Uganda,
And the
you
Minister of Health
can
also
have
has-
seminars in the Ministry of Health,
In the boardroom.
in the boardroom of Ministry of Health. That building belongs to government. You can have a seminar in Mulago Hospital. The places,
Even Makerere University.
Makerere University belongs to the government of Uganda. We can have seminars there if we want to change this thing of eating money. So we throw the budget out. Right now, I'm coming from the Social Services Committee, and we have readjusted the budget.
Yes.
And the adjustments we have made, they are a bit tentative, but tomorrow we have again to do some more surgery. I wouldn't want to give you the exact figures now, because
Give us
I
an
don't-
idea.
But the idea is, honestly speaking, Ugandans who are listening, we have totally removed seminars from this money.
Oh, so no seminars?
No seminars,
Really?
as far as the money for reproductive health is concerned in this country now. Because even the Minister of Finance told us, that, if I can put in Uganda, we must go in serious business.
No more luxury.
No more luxury, actually. Let me tell you something. By the way, there's something I found. Today I was looking at the ministerial statement, ministerial process statement of Minister of Health. I was looking at some pages which I want to tell you. I found that seminars, tables, chairs, and entertainment in the ministerial process statement of this government this year, somebody who was budgeted wonderful money and travel abroad and inland 11 billion. How do you travel abroad when we have women dying actually in villages? We are saying no, and the president is backing us. I can tell you, the president.
Yes.
No.
Oh, yes.
Our president has said this thing of travels and seminar and hotel. It has to stop. Which means that when we are doing these things, by the way,
He's also telling
we are doing them because we know we have some backing.
Right.
Whoever has been going for seminars every weekend and budgeting and balancing books should stop. We want to go into business and we save our people from dying in this country. That is what the 9th Parliament actually is aiming to do before it leaves after 5 years.
This is Spectrum on Radio 1. Tonight, the quest for better healthcare service delivery in Uganda. What other key issues that need to be addressed to make this situation better? We're going for a break. When we come back, you'll also be able to contribute to this discussion. Do stay tuned.
Let's show you how to multiply your savings, starting with the cash beneath the mattress to the savings in the bank that aren't making money. Let's turn your savings into some things with Super Save Reloaded. Super Save Reloaded brings you savings and investment accounts which offer you a sure and predictable way to multiply your savings. For more information about Super Save Reloaded, ask at your nearest Stanbic Bank branch.
Stanbic Bank, moving forward.
3 times a year, every year for the past 6 years, I have been stressed going to pay school fees. I've woken up at the crack of dawn, taken 2 taxis and a board. Finally arrived, filled out the forms. I have lined up between a guy with kavubuka and a guy with a nasty cough. And I've waited and waited, but no more now. I have moved on with MTN mobile money. So now I pay school fees directly from my mobile while I spend time with my children.
When you move on with MTN mobile money, your children can move on to greater things. And now, everyone can pay school fees with MTN mobile money. So, be one of the 100 people to win 100,000 shillings towards your next school shopping when you pay school fees with MTN mobile money.
MTN. Everywhere you go. Let's talk about the home of your dreams and how you plan to finance it. Let's discuss money, location, and time frames, and whether you plan to build it or purchase it or renovate it. Let's make it possible for you to get started now so that you get into your own home sooner rather than later. Let's enable you to borrow against your house so that you expand and meet all your financial needs. Let's offer you a Stanbic Bank home loan. To find out if you qualify for a home loan, ask at any Stanbic Bank branch today.
Stanbic Bank, moving forward.
Even back when I met George, I noticed something different about him. Maybe it was the way people looked up to him, or maybe it was his willingness to always help. He struggled at the start, and today he is a successful bar owner. Despite his success, George didn't forget where he came from. He built friendships with his patrons and learned from them as much as they learned from him. He used his business acumen to help many others achieve their dreams. The fact is, many people owe their success to him. But George never talks about it. He's just who he is. Special.
So here's to men like George, who make a difference, who enjoy Nile Special, the rich, satisfying taste from the source. Nile Special, you've earned it.
Not for sale to persons under 18.
Spectrum on Radio 1 FM 90 is brought to you by Stanbic Bank.
Welcome back on Spectrum tonight. The quest for better healthcare service delivery in Uganda. What are the key issues that need to be addressed to make the situation better? Our guests tonight, Dr. Medard Bitekerezo, Mbarara Municipality Mp, also member of the Social Services Committee, Honorable Rosemary Najjemba Muyinda, Chairperson of the HIV and AIDS Committee of Parliament, and also member of Parliament for Gomba constituency. You'll be able to call in later. I'll read out the numbers when that time comes. Honorable Najjemba, let's look at the priorities. I'm looking at maybe 5 areas where health, you can spend money on health. Building health centers, having workers well paid. Number 3, drugs. Number 4, training. And number 5, research. Where would you want this money to go?
I'd be very comfortable if the Ministry of Health reorganize their priorities, because to me you cannot talk about improving health services when you are continuing to put money in meetings.
Yes.
That's one. We already have health centers. We have the health center 4, we have the health center 3, and health center 2s, and we also have village health teams at village level. All these structures are very good because our people can now access health services. They don't need to walk very long distances, because at least you can access the health center 2 or 3.
It's about 5 kilometers.
It's about 5 kilometers.
That's the longest distance.
So, but you find these are white elephants. The drugs, many times.
Explain that to us clearly.
White elephants, they are buildings. They are
cobwebs inside. Nothing else happening.
Yes, yes.
No staff, no drugs.
Yeah, the situation, their conditions are not the best. I can take an example of my own, because I always go there, and you find even the birds have
a domicile inside the house.
They are inside the roof, and and the situation is really not the best. But how come if the ministry
on the street? What exactly do you mean? No beds? What is it? No.
Sometimes they are not beds in many of them. There's no electricity. It is in total darkness. Even toilets. You find some of them a health center which doesn't have a latrine or a toilet facility. Many of them lack such facilities, basic facilities. To me, I think the Ministry of Health should, first of all, before even thinking of building more health centers, first of all, rehabilitate the ones that we already have. Cool. Because they are in appalling conditions.
Yes.
The health centers that we have in the country are not worth calling health centers. So for me, the priority should be rehabilitate and equip the existing health centers, the structures that we have.
Yes.
The staffing, but also that one goes with the remuneration payment of health workers.
Yes.
They are not well paid, and many of them, that's why they go abroad. He has been talking about capital flight. That's why they go to look for greener pastures, because they are not well paid. And one time I was on the floor of Parliament, and I challenged my colleagues, the doctors and the other health workers in the House, and I told them maybe that's why some of them are in Parliament. That's not to say that that's why you are in Parliament, but so long as the payment is not comfortable for this health worker, they will always look for an exit, and they will end up wherever